Hello, my name is Jim Fenton. I'm the medical director at Empathetix Wellness, based here in Salt Lake City, Utah. My background consists of primary care, hospice, palliative care, pain management, and also plant-based medicine. At Empathetix, we've helped so many people with our weight loss program, our hormone therapy program. We are now working with mental health issues, such as PTSD, anxiety, depression, addiction recovery, and we use ketamine therapy to help with that. It's been working really well. We've had so many patients just do so well with the ketamine therapy. What it does is it allows for the brain to reset. It works on the limbic system where our emotions and behaviors are processed. So it allows, our brains are awesome. It allows, our brains can regenerate, it can heal itself, correct itself. So the ketamine helps work in those limbic regions where we have those behaviors, those emotions, allowing the brain to make new neural pathways or new thought processes that help us deal with our addictions or whatever ails us, or or depression or anxiety. Ketamine is kind of like an etch board. You shake it up, you start fresh. It allows for the brain to reset and make those new pathways, allow us to make better decisions and help in addiction recovery. It's been awesome to see the guys at the tribal house. They come, sometimes they're sick, sometimes they're detox and need meds, but week after week we see them getting stronger mentally, physically. They're going to the gym. They're getting a hold of their addiction. They're making lifelong friendships at the tribal house. We've had so many families just thank us just for taking care of their loved ones. They come back just a whole different person and have a better grasp on what was going on and are able to deal with it better. We also use plant-based medicine or medical cannabis to help with behaviors, addiction. It helps with the withdrawals. It helps with the cravings. It helps us reset ourselves to set, to let us know where we're at. It helps take the edge off the anxiety. When we have an addiction, we have those cravings, we're withdrawing. The medical cannabis helps us kind of deal with that. It takes the edge off, it makes us feel better, and it kind of takes away a lot of the cravings, honestly. It's just great to see our guys go through this. I love working with our ketamine therapy. I love working with the cannabis. I've seen it change so many lives, and we're just glad we can help people.
Of all the different types of medical practice you've done, where does this addiction recovery, helping the tribal house guys, rate on being rewarding in your medical practice?
Oh, it ranks higher than, because I've dealt with a lot of chronic pain management patients or people who are addicted to pain meds and they say they want to get off of it, they're trying, they just can't do it. And I can only do so much from an office or when I just see them once a week or once a month, So with this, I'm in better contact with them. They're in a safe place. We're monitoring them, and they're actually there to be helped. That's why they're there. So they're honestly, that's the first step. When you ask for that help and know that need that help, that's when help comes, and that's when you're able to deal with your addiction.
Wonderful. We know that the NIH is doing a lot of studies with pornography addiction, gambling addiction, and alcoholism. Do you think that ketamine therapy is also helpful for just general drug addiction?
Yeah. Oh yeah. I think it's honestly it's helpful for so many things. Just because all that comes from that limbic system where we form. There's a lot of things back there. The hippocampus, our limbic system is all dealt with our behaviors, our how we deal with things, how we process things. How we form new memories, how our memories are, and just the ketamine rewires our brain, because the addiction rewired it from where we were to begin with. Ketamine just helps us get back into a stable state. That with the cannabis helps us, our bodies have more homeostasis, and it works really well. I mean, and it's not taking one drug to get rid of another, like methadone and stuff like that.
I'm glad you brought that up, because families that don't understand, why are you using medical cannabis, or why are you using ketamine? It's like you're switching one drug for another. How would you answer that to a family member that's naive about this?
So, I mean, if you look at it that way, it can be, but it's not. So like medical cannabis, it's natural. We know where it comes from. There's nothing added to it. is not addictive. I mean, there are some people that can be mentally addicted to it, but it's not like physically addictive. So if you go to methadone because you're on addicted to something else, you get addicted to methadone. It's really hard to get off of, and methadone is a really scary drug. It's not good for you. You got to monitor it very closely, and it honestly is. If you stop methadone, you're going to start withdrawing. If you stop cannabis, you don't. So and I've seen it. I've seen people try the methadone route, and it doesn't work. They're okay, they're functioning, but when I've seen them switch to cannabis, they got off all those core narcotics. They're getting off the couch. They're going to work. Their lives are so much better. I mean, it is very awesome to see it.
Awesome. Well, we're grateful for all you do for the Men's Tribal House clients and fighting addiction, and we're grateful for your cutting-edge approach with addiction treatment here in Utah. Thank you so much, Dr. Fenton.
Yeah, thanks.